Hello, my name is Steven Christiansen, and I am a co-author of the article entitled The Effect of Preoperative Keratometry on Visual Outcomes in Moderate Myopic LASIK. The relationship between pre-op keratometry and visual outcomes in LASIK has been studied in high myopia and hyperopia, but not in moderate myopia. The purpose of this study, therefore, was to evaluate visual outcomes in moderately myopic LASIK in eyes with flat and steep corneas preoperatively. In this retrospective analysis, 96 eyes with pre-op spherical equivalent of -2 to -5.99 diopters and average pre-op keratometry values between 39.9 and 42 diopters were matched with 103 eyes with similar pre-op spherical equivalent and average pre-op keratometry values between 46 and 47.2 diopters. Primary outcome measures were refraction, visual acuity, change in keratometry, and change in spherical equivalent. Here you can see the outcomes at 6 months postoperatively. Significant differences were found between the flat and steep groups in post-op spherical equivalent, sphere, post-op keratometry, and change in keratometry. In this graph, you can see a stratification of eyes into the percent of eyes achieving spherical equivalent of -0.25 to +0.25, -0.26 to -0.5, and -0.51 to -1 diopters, with all three categories producing a statistically significant difference between the flat and steep groups. Here you can see that significant differences were also found in the percent of eyes achieving uncorrected distance visual acuity of 20/15 or better, wherein 42% of eyes in the flat group achieved UDVA of 20/15 or better compared to 19% in the steep group. These findings suggest that moderate myopic eyes with flatter corneas tend to have better visual outcomes after LASIK than eyes with steeper corneas preoperatively. Further studies should be performed to better define the effect that keratometry has on LASIK outcomes in varying levels of pre-op refraction. The findings of this study will also assist surgeons to better predict prognosis in eyes with keratometry of 39.9 to 42 diopters that may have previously been found ineligible for moderate myopic LASIK, and to consider more aggressive laser ablation in eyes with keratometry of 46 to 47.2 diopters to avoid the undercorrection described. Currently, many refractive surgeons use nomograms that do not include pre-op keratometry values to calculate post-op refraction, though we suggest that pre-op keratometry should be one of the featured factors in pre-treatment nomogram calculations. Thank you.